Artificial intelligence. It's a buzzword we keep hearing everywhere. From driverless cars and smart homes to financial algorithms and entertainment recommendations. But what about healthcare? Can AI truly replace doctors? Or is it simply a tool that can enhance their capabilities? And more importantly, should we even consider replacing doctors with AI? Today, we're diving deep into this fascinating and highly controversial debate. Welcome to AI in Healthcare, where we explore the cutting edge of AI and its implications for the world of medicine. Before we jump into this discussion, make sure to hit that subscribe button and click the bell icon to stay updated with our latest videos on AI and healthcare. And if you enjoy what you see, don't forget to smash the like button and share your thoughts in the comments below. Now, let's get started. Artificial intelligence in healthcare is no longer just a futuristic concept. It's here, and it's evolving at an unprecedented rate. AI systems are being used to diagnose diseases, assist in surgeries, analyze complex medical data, and even predict potential health risks. And it's doing all this faster and in some cases more accurately than human doctors. But here's the critical question. Can AI ever fully replace doctors? Is AI's precision and speed enough to outweigh the wisdom and empathy of trained professionals? Or is the ideal future one where AI and doctors work together to provide the best possible care for patients? Let's break down the reality of AI in healthcare, the opportunities it offers, the risks it poses, and whether a world without doctors could actually work. To understand whether AI can replace doctors, we first need to look at how AI is already revolutionizing healthcare today. Let's break it down into several areas. Diagnosis and early detection. AI is remarkably good at analyzing medical images and data. Systems like Google's DeepMind can predict eye diseases with incredible accuracy. IBM Watson assists doctors by analyzing vast amounts of clinical data, providing recommendations for treatment plans within seconds. AI is also being used to detect diseases like cancer, heart conditions, and even neurological disorders at an early stage, giving patients a better chance of recovery. Surgical assistance AI-driven robotic systems like the Da Vinci surgical system are performing surgeries with precision and consistency that far surpass human abilities in many cases. These robots can make smaller incisions, reduce recovery times, and enhance surgical accuracy. Predictive analytics. AI can process vast amounts of health data to identify patterns that can predict disease outbreaks, individual patient risks, and even potential medication side effects before they occur. Personalized medicine. Through machine learning, AI is enabling more customized treatment plans that consider individual patient genetics, lifestyle, and environment. But all of this brings us to a fundamental question. If AI can do all of this so well, where does that leave doctors? Keep watching as we explore the limitations of AI and why replacing doctors may not be as straightforward as it seems. Despite its remarkable achievements, AI is not without its flaws. In fact, there are some significant limitations we need to discuss. Lack of empathy and human connection. AI may be able to diagnose diseases with high accuracy, but it fundamentally lacks one crucial element: human empathy. When a patient is suffering, they need comfort, understanding, and reassurance. Can a machine truly provide that? Ethical and moral dilemmas. What happens if an AI system makes a fatal error? Who's responsible? If AI systems are trained on biased data, can they make unfair or harmful decisions? What about patient privacy and data security? How do we ensure that sensitive medical information is kept safe and private when handled by AI systems? Limited understanding of complex cases. While AI excels in pattern recognition, it struggles with complex, multidimensional cases where emotional and social factors play a significant role. Reliability and accountability. AI systems can make mistakes, and when they do, the consequences can be devastating. In medicine, a single wrong decision can be a matter of life and death. Should we be willing to place such a heavy burden of responsibility on machines? The truth is, the future of healthcare doesn't have to be about AI replacing doctors. It can be about AI empowering doctors. Imagine a world where AI handles the data crunching, pattern recognition, and diagnostic predictions, while doctors focus on patient care, treatment plans, and making judgment calls only humans can make. Collaborative healthcare AI systems can assist doctors during surgeries, improving precision and safety. Provide real-time diagnostic support, suggesting potential conditions for doctors to consider. Help manage patient data, making it easier for doctors to focus on the patient rather than administrative tasks. Examples of collaboration. Radiologists are already using AI to analyze X-rays, MRIs, and CT scans faster and more accurately. AI chatbots are being used to provide preliminary diagnostic suggestions, which doctors can later confirm or adjust. Predictive analytics is helping public health officials prevent disease outbreaks before they even occur. In this vision of the future, AI is a tool, not a replacement. It's about using AI to enhance the capabilities of doctors, not eliminate them. But of course, this leads to another critical issue: ethics. If we want AI and doctors to coexist, we need to address the ethical and social implications of such a partnership. Now, we've talked about how AI can assist doctors, but there's something we need to address: the ethical and social implications of AI in healthcare. This isn't just about technology, it's about morality, trust, and responsibility. Ethical concerns. 1. Accountability. If an AI system makes a mistake, who is responsible? The developers, the healthcare providers who use it? 2. Bias and fairness. AI systems can inherit biases from the data they are trained on. If not properly managed, this can lead to discriminatory practices in healthcare. 3. Privacy and data security. AI systems rely on massive amounts of data. How can we ensure this data remains private and secure? 4. Patient consent. Are patients fully aware of when AI is being used to make decisions about their health? And should they have the right to refuse AI-driven care? These issues need to be addressed if we want AI and doctors to coexist harmoniously. The solution is not to reject AI, but to regulate and guide its use responsibly. But what do you think? Is AI worth the risk, or should we draw a line before it's too late? We'll answer that in the final part of this video. So, can AI replace doctors? Not entirely, but it can revolutionize healthcare as we know it. The future is not about AI replacing doctors, it's about AI empowering doctors to do what they do best: save lives and provide compassionate care. Together, AI and doctors can create a healthcare system that is faster, more efficient, and more accurate than ever before. But here's what I want to know. What do you think? Should AI have a bigger role in healthcare? Or should it remain a tool rather than a decision maker? Leave your thoughts in the comments below. I read each one of them. And if you found this video informative, don't forget to like, subscribe, and share it with your friends. Hit the bell icon to stay updated with our latest videos on AI and healthcare. Until next time, stay curious and stay healthy.